Yes, it seems good sign is coming, Kunthepchai, especially today with the lowest case of infection, lowest in about a month with the figure of 27.
That's true. We certainly want to heave another sigh of relief to see the numbers of new infections continue to decline like this. But of course, it's not all good news for some of our ASEAN neighbors, right, Kunatha? Singapore, for example, has seen a sudden spike in the number of new infections. So tonight we'll have both Thai and regional perspective on the situation. For Thai perspective, we have Kun Gorn Jatigamanit, former finance minister and now leader of KLA Party. And for regional perspective, we will have Mr. Simon Pei, chairman of Singapore Institute of International Affairs. So tonight we will have both perspectives on this very crucial issue.
As of now, the emergency decree will have to be maintained in Thailand, Kunthepchai, even though it has been in place for about 3 weeks. And the case of infection has been on decline. But we have been told regularly, especially in the press briefing, that we have to maintain the guard quite high to keep it up at the high level. And even though people may be speculating whether the government is considering to ease the restriction, but there is no confirmation yet as of now.
Yeah, and Dr. Visanu Krungam, the Deputy Prime Minister in charge of legal affairs, made it clear today that in the meeting of the Center for COVID-19 Situation Administration, CCSA, you should have become familiar with this abbreviation by now. The center met today under the chairmanship of the Prime Minister, Prayut Chan-o-cha. And according to Dr. Visanu, there was no discussion of the suggestion that the restrictions imposed so far should be relaxed or not. It looks like the Prime Minister is still not very happy with the numbers, despite the fact that the number of new infections has gone down, but the overall picture is still a challenge. So that's why, according to Dr. Visanu, the Prime Minister certainly wants to see more progress before any decision can be made on whether or not the restrictions will be eased.
The rate of infection is quite interesting, Kunthepchai, because today during the press briefing by Dr. Tawisin Visanu-Yothin, he has picked up infection rate that per one person as of now it's 1.12 and it's quite acceptable at this rate. But according to epidemiology studies, if it had been expanded to one person and infect another 1.8 person, that will be totally different story. It means higher increasing number of people who will be infected of this. That's why it's come to the conclusion that right now restriction or to ease restriction has to be considered very much in detail.
Yeah, I think that's one of the biggest questions in most people's minds right now, that whether or not or when the restrictions will be eased. But if you listen carefully to Dr. Tawisin's remarks today, I think he did not rule out the possibility of the restriction being relaxed in the near future. But of course, he wants to see certain conditions met before any decision is made to lift or to relax these restrictions. And he attributed, of course, the success in bringing down the infection cases to the curfews, to the strict practicing of the social distancing measures that have been in place over the past several weeks. So he certainly wants to see high degrees of these measures to continue, while agreeing that certain measures could be relaxed.
That's right. And according to World Health Organization, there is 6 conditions if Thai government would like to relax all the restriction. And this is according to what the press briefing Dr. Tawisin has told us since Friday, but it has been repeated again that the condition from WHO would be clear guideline for Thailand. The first one is disease transmission is under control. Second, health system can detect, test, isolate, and treat every case and trace every contact. The third, outbreak risks are minimized in vulnerable places such as health facility and nursing homes. The fourth, schools, workplaces, and other essential places have established preventive measures, and risk from imported new cases can be managed, and communities are fully educated, engaged, and empowered to live under a new normal.
Yeah, according to Dr. Tawisin, at least 4 of these 6 conditions as outlined by the World Health Organization have been at least partially met in Thailand. Of course, the last 2 conditions, one dealing with the importation of cases from abroad, and the other with the education and understanding of the seriousness of the situation, are probably 2 points of concern for Dr. Tawisin. As pointed out today, he said that according to latest reports from the Foreign Ministry, there will be as many as 8,900 Thais on the waiting list to return to Thailand in the next few weeks. And of course, it's a major challenge on how to deal with these people to make sure that these people have been thoroughly screened before they are allowed to embark. And then once they're in Thailand, they will be subject to screening and then in a state and local quarantine. And if that can be done with high level of confidence that these measures will be tightly maintained, then this condition will certainly be met. But of course, Dr. Tawisin, every day when he speaks at the daily press conference, he always expresses concerns at the fact that there are still many Thais who don't take any precautionary measures at all when they go outside. There are still a lot of people who hang out at night and get together in big groups for drinks and things like that. So this is one point that he believes that still reflects the lack of understanding of the severity of the situation by many Thais.
And as of now, we can see how medical doctors have discussed exit strategy in Thailand, Kunthepchai, regarding overall situation. But of course, the medical doctors still have to warn the Thai community, overall country, that too early of the ease of restriction, there is a dilemma that perhaps there is consequences coming if the restriction has been relaxed too soon. But of course, they would have to evaluate the situation quite accordingly. And there is a group of 14 medical doctors who has revised all the situation. And probably in May, 32 provinces which doesn't have report of new infection would be like the test of whether restriction can take place. And with different measures, we'll have to discuss. If restriction has been eased, what kind of business can be back to life and what kind of business still have to be closed? That will be issue of discussion in the near future.
Yeah, that's of course one of the biggest challenges facing the government at the moment. Which businesses to be allowed to reopen, under what conditions that they will be allowed to do so. So I think this will be the main question occupying the government in the next 1 week, after which the current state of emergency will expire. The Prime Minister will have to decide whether or when or by how much longer the state of emergency will be extended.
So next week would be probably a clearer indicator for Thailand, because it would be 2 weeks after Songkran festival, exactly 14 days. So that will be a good indicator what will happen to Thailand in terms of infection and whether the government will decide to ease restriction.
And meanwhile, Kun Natha, good news for medical personnel fighting the coronavirus and bad news for Bangkokians because today the Bangkok Metropolitan Administration has decided to extend the ban on alcohol sales in the city until the end of this month. In fact, the ban expired last night, at midnight. So the BMA, the Bangkok administration, believes that the ban still needed to be in place to help fight the spread of the coronavirus. So that's why they decided that the ban should be continued at least until the end of this month.
It must be quite disturbing situation because for the 27 new infection today, many of them have been infected because of having dined together or still have been to nighttime group gathering, and that's still the case of concern. That's why the government still have to be quite careful in terms of consuming of alcohol.